All right, you may proceed.
If you would introduce yourself.
My name is Rebecca Kirk. I'm a licensed professional counselor.
And Rebecca, where do you work as a licensed professional counselor?
I'm an owner of a small practice called Magnolia Counseling in Madison, Mississippi.
If you could tell us just a little bit about your educational history.
I received my undergraduate degree in English education from Mississippi College, and I taught some prior and most of it simultaneously while I've been a licensed professional counselor. And then I received I taught accelerated English mostly, so gifted students chiefly, in the 9th grade at Madison Rosa Scott for 14 years. And 2 years in Virginia. And then I also received my master's degree in marriage and family therapy and individual counseling from RTS Jackson, which stands for Reformed Theological Seminary. And that consists of a very robust master's degree program where we do 400 face-to-face contact hours in clinic, and then 600 indirect supervision hours, and then postgraduate degree we work and do 3,000 more hours with the public under a licensed supervisor before sitting to take the mental health equivalent evaluation that the state requires for licensure. I also have to do 24 hours of continuing education classes every 2 years to maintain that certification and licensure.
And so is it safe to say that you are in fact licensed?
I am.
And you were back in March of this year too?
Yes, ma'am.
Rebecca, it sounded like you have a lot of experience working with teenagers too.
I do.
Did you have the opportunity to have a patient or a client by the name of Carly Gregg?
Yes.
Do you see Miss Gregg in the courtroom?
Yes.
Same Miss Gregg that you provided services to?
I do.
Do you keep medical records with regards to the sessions that you have with your patients?
I do.
May I approach the witness? Rebecca, I handed you what's previously been marked as State's Exhibit S21. Actually, I think that might be Defense Exhibit D21, excuse me. If you'll take a look at those for us.
Okay.
Do you recognize that document?
I do.
And what is that?
These are my entire treatment notes and summary of counseling Carly Madison Gregg.
And in some of those notes, Rebecca, when we got them, there was some writing, like some handwritten stuff in that.
That's right.
Who did that?
Okay, so that the original intake form that she's referring to is completed by Ashley Smiley. Or was completed by Ashley Smiley, and the last page concludes with questionnaires, checking off like just main mental problems that a person might be experiencing. It also asks to list the goals for therapy. And the first session that I have with someone, I go over the fact that since she's a minor, I need to speak with just that first session, one of the parental guardians, unless there is a need to contact them otherwise. I make that very clear to any minor and any adult that I see, that confidentiality, and I do kind of want to say this, is very important to mental health professionals to maintain confidentiality and to not really betray that trust. That's very important, and I am doing that somewhat today from some people's perspective, but I'm not according to the Mississippi state law, because of when you declare reasons of insanity, I do have permission to discuss. She has given me permission to discuss her medical history. So confidentiality is important to me, and I make that extremely clear. I just did then. Sorry for that. I worked with teenagers for many years, and so any mental health professional does say and has a duty to say that it is confidential under with the exclusion of just a few circumstances, which would be if someone reports that they're going to harm themselves, if they know of a threat of harm to themselves or another, or if there's any physical abuse. And so I did meet with Ashley Smiley to answer your question for a portion of the first session. And so it's kind of confusing, that last page. I want to explain it. She completed it. She said that there were 3 goals. There are also questionnaires, that are customary. Is it helpful for me to describe what's on this last page or no?
Sure. If you'll just tell us, let me take a step back.
Sure.
If you would, what was the date that this paperwork was filled out?
This was her very first session with me, which I think was January 22nd. Does that sound right? 2024.
Your records reflect the first time you met with her was January.
Yes, that's right. I see it here. Mm-hmm.
So, and I apologize, I interrupted you a little bit. Yes, if you'll just tell us sort of what this handwritten note reflects and kind of talk us through that first visit with Ashley and Carly.
Okay. So the first note that I have was completed, or the first set of goals on that last page of the intake form says, by Ashley, she wants to feel better about herself. And secondly, another goal would be self-care management, internal thoughts. So then I followed up, and she also wrote, Carly has been complaining of sleeping trouble and thoughts of depression, hopelessness. We discovered issues of cutting and taking old sleeping pills. Those issues have been removed and controlled, but also signify the possible level of depressive thoughts. So then I would continue to just question Ashley Smiley and, wrote down on the same sheet some of the answers she gave me. And then I met with Carly the same session and added to some of that information on the same page that Carly, based on talking to Carly.
I want to talk to you kind of down at the bottom of that page, Rebecca. There's some things. It's kind of almost like a checklist. This actually says checklist of current functioning, and then somebody has marked easily angered. Do you know, is that something that you would have done, or that either Ashley or Carly did? Either
Ashley or Carly, and I would assume it would have been Ashley, but then I confirmed and went over it verbally with Carly as well.
So they both reported that she was easily angered.
Yes.
It does say that she has intrusive or disturbing thoughts. Did y'all talk about what that meant?
Yes. Just basically, I asked her, one of the biggest things that you do is you ask why now, because a lot of times people do war with common stressors and then more severe ones, and I wanted to know exactly why they were coming. And Ashley had said that Carly had been cutting herself, or she had found an old iPod, and in that old iPod she found out that Carly had been cutting herself for some time, and she also described some dark thoughts. And so I tried to kind of get to the bottom of what that was, thinking that they were, representative there by that check mark of has intrusive, disrupting thoughts.
And at some point they talk about, you have notes, and it looks like they mentioned that Carly has trouble going to sleep at night.
That's right. And that seemed to be a big deal to her, the sleep issue.
When you're treating a client, how important is it that you're getting accurate information from them?
Extremely. Again, that trust is so important. And so if you're not receiving the correct information, you can't see the whole picture. So you can't really treat the person in the appropriate ways, tailored for them.
We talked about that you had a meeting with Ashley and that you met with Carly. Who knows Carly better than herself?
Yeah.
No one, right?
Right.
So I want to ask you, Rebecca, on this first meeting, did Carly ever report to you any use of illegal drugs?
No.
Did she ever report to you that she was hearing voices of any sort?
No.
Did she ever report that she was having any sort of hallucinations?
No.
What about, did she ever report to you that she was having memory trouble?
No.
What about feeling derealized?
No.
Did she or Ashley ever bring up the word disassociation?
Mm-mm.
And to be clear, I want to talk about the first day, but was there ever a time in your treatment of Carly that she reported that she was having any sort of blackout? Like there were times where she didn't remember what she'd done?
No.
So on the first visit, you kind of go through the current functioning and the checklist with Ashley and Carly. And then you actually provided some chart notes from that same meeting.
That's right.
If you could, I think you talked about this, that Mom reported there was a burner phone. If you'll look down on page 2 of your records, it says Mom was upset that she lied, and when she asked about the relationship. Is that something that Ashley conveyed to you, that she was upset Carly was lying to her?
Yes.
And then when you go down a little bit, there's a little bit of handwriting, and I think it says her bio dad.
Correct.
Who wrote that in the records?
I did. It was a grammatical just edit for clarification.
And to be clear, there's some other times in the
Right.
records that when you produce these, you went in and kind of wrote names.
Because I want to be fully present, but I also want to take, records of what's going on for my need later to help her.
See, it says that she was 4 when her parents separated due to, and you put his and then her bio dad's pill, alcohol, and pot addiction. It goes on to say he was getting high in front of her. Do you remember who told you that?
Yes, both of them did. Ashley actually kind of broke down teary-eyed in the session, which I inferred was what we all feel as parents, which we, feel, am I the best parent? She felt a little bit, I read and then told her this is not your fault, because she had discovered that he had been doing that for quite some time before Carly told her. It may have been like a year and a half, and I didn't get the impression the visits were often, but I mean that's irrelevant. When she went, said that he would be high constantly in front of her with drugs all around, and then when she did tell her mom, she stopped, and then they were in actually court discussion with trying to terminate his rights, I guess, permanently, and that was actually going on while she was seeing me.
And so she's got these other things that Ashley's told you about, the sleep trouble and the things, but you also learned in meeting with them that there's a custody battle going on.
Correct.
What about, your note also says she was also taking sleeping pills because last month she hadn't been able to sleep and woke up at 2, and then it talks about now she's taking melatonin. So I want to be clear, in your records, it appears that the melatonin is not the sleeping pill.
Correct.
She was taking.
In fact, it was my perception at the time that that was one of the things Ashley was upset about, is that she was taking sleeping pills.
Did they ever tell you where she'd gotten those?
No, I know nothing more than that. Sorry.
Is there anything else that you recall specifically about that first interaction with Carly that we have not discussed?
The whole impression of working with her overall seemed to me to center on what was making her cut, these dark, nights of the soul, so to speak, when she was, she reported having like existential thoughts about life and, the meaning and things like that. And so that's kind of what I flagged in my mind as a practitioner to try to develop more trust and a desire to go there to see what was troubling her.
And do you recall, you said you kind of build rapport, trust with these people. Do you remember how many times you actually saw Carly between the first visit and your last visit with her?
Yes, I saw her every week, every work week, once a week, for a total of 9 sessions, which would have been 9 hours, not counting that time with Ashley, so it would have been a little less, that first session.
The next time you saw Carly in your records is from February the 2nd of 2024. Is that right?
Yes.
I want to talk to you. It says persons in attendance, patient. So can you describe for us, what that means?
I am trying to see where you are. Can you tell me what page you're on again?
Yes, sorry. Page 4 of 24.
Okay.
And then about a little more than midway down on the bottom, it says persons in attendance. It says patient.
Patient, right.
What does that mean?
She was the only one there from session 2 to session 9. spoke and interacted with only her, with the exception of Ashley always brought her to her appointments. I don't think I think that's an accurate statement. I think her stepdad did come with Ashley maybe like once or twice. I know like on Valentine's Day, for instance, they were together.
But he didn't ever come into the room?
No, nobody ever. It was just the waiting room. So I would see them in the waiting room, and, that was all.
On that same page, Rebecca, you did, it looks like kind of an assessment of what you might do of a patient each time you meet with them.
That's right.
Could you tell us what you observed of her behavior that day?
Yes, it says appearance, normal, grooming and hygiene, attitude, calm and cooperative, behavior, no unusual moments or psychomotor changes, speech, normal rate, tone, volume without pressure, affect, normal range, congruent, thought process, goal-directed and logical, perception, no hallucinations or delusions, orientation ×3, so that's like you know where you are, like you know the time, you can see where you are, hear where you are, those kinds of things. Memory, concentration, short and long term intact, insight, judgment, good, mood, stable and angry and sad.
So she reported to you that she was angry.
Mm-hmm.
And I want to take kind of a couple of those one by one, Rebecca.
Okay.
You talked about behavior, no unusual movements or psychomotor changes. Can you tell us what that means?
Yes. Sometimes people are just very clearly on edge and they can't get to a calm place, and that's evidenced by a lot of movement in their chair or their body that's maybe not related to their emotional feeling of something they're describing necessarily, and then just like rapidity of speech, like very rapid, maybe loud speaking, things like that, maybe looking around a lot.
And you didn't notice any of that?
I did not notice any of that ever.
And it says her thought process was goal-directed and logical. What does that mean?
She was able to carry on a conversation coherently without distraction, and that would have been okay if she was distracted, but she's very gifted and very, good with her words, and we discuss things in a normal manner.
You said perception, no hallucinations or delusions. What does that mean?
She was not reporting seeing or seeing anything that wasn't there, or not being present with reality or anything of that sort.
And what about her memory and concentration? What did you notice from that day in February the 2nd?
Her short and long-term memory seemed fine to me.
I want to talk to you about what your actual note says from that day and that visit. It says she's frustrated that her friends don't take school as seriously as she and loses her patience. Tell us what you meant when you wrote that. She
was gifted, as I think is a clear fact. She really enjoyed school, and I taught her type of student for 14 years. And so she had like an excitement to talk about school, and she also, I thought that probably one of the things she was dealing with that was difficult for her was possibly that sometimes when you're so gifted and different from others in any way, it doesn't have to do with that, you might feel lonely and a little bit more isolated. So I kind of attributed it mentally. I made a mental note that was probably a relation there. But she was just, the patience part, she was just described like being frustrated with peers who were not as quick as she, and that she knew she could be a little rude with them. We also kind of talked about it's difficult when your mom maybe is a teacher too, because you appreciate good teachers and know how hard they work. And
Rebecca, your notes say that she's regretful when she snaps at them and hurts their feelings. So Carly was reporting to you that she's like snapped at some of the kids at school.
Yeah, and I did not get the impression it was in a violent way, but maybe like her temper, she knew that she was losing her patience with them.
And later on, about midway, it says she gets angry at others sleeping through such good teaching.
Yeah.
That's kind of what you were talking
Mm-hmm.
about, that she recognized she had good teachers.
Yeah.
I want to talk to you, Rebecca, about the next time that you saw Carly. I think you told us that you were seeing her pretty much weekly. The next record I have is from February the 9th of 2024.
That's right.
Want to talk to you again about what you observed from Carly and what you put in your notes regarding her behavior.
Okay. You just want to know
Page
that.
6, yeah, of 24.
Okay, the appearance and stuff.
That's right.
Okay.
Yes.
I think, let me just look at it to make sure I'm not misspeaking. Everything that I read a while ago, and I can read it again if the jury would like that, was normal, except the only change I made was her appearance. I specified her appearance was goth-like, wearing her grandmother's batwing black goth pants and straight hair partly in her face.
But everything else was in normal limits. Her behavior, her speech, her affect, her thought process, the fact she was not having hallucinations or delusions.
Correct.
Her orientation to time, place, and what's the third one? I'm sorry. Times 3.
Time, place, and your hearing, like just all of your 5 senses,
Okay.
you're aware.
And then memory and concentration, short and long term, were intact.
Yes, correct.
And then you also have some treatment notes from that day.
That's right.
I want to point you down to, it's toward the bottom of the paragraph. Toward the bottom of the paragraph it says, she has started cutting. If you would, can you read that sentence for me?
Yes. Okay, she has cut, not currently, but in the past, when alone and in her head a lot. It was my understanding that what kind of prompted treatment with the psychiatric nurse practitioner, Olivia Lieber, was that she had found that iPod with this information about how she had been cutting and how she had some dark thoughts. And I was trying to follow up, like I was saying a while ago, with like what was going on with you, like in those times.
And I think your note actually says, Rebecca, after some existential crisis moments of her atheism resulting in a lack of consciousness.
Correct.
Can we break that down just a little bit?
Sure.
Those are some big words for me.
Yeah, that's fine. So I never really could get her to open up about that very much. And I want to be clear that atheism, that was something that I was kind of trying to think might be a possibility. She didn't, as I recall, really use that word. But she did mention the word existentialism, and basically, in my opinion and training, I do think that's related to thoughts of what is the meaning of life, what's its purpose, why are we here? It was my and I could talk more on that maybe, but basically she would get in a depressed state and cut, and she described it as an existential crisis. But I couldn't really get her to describe a whole lot about that.
Okay. But you tried to ask her about that.
I did, yeah.
I want to take you to the next time you saw Carly, Valentine's Day, February the 14th of 2024. And I apologize, Rebecca, I didn't ask this earlier. At the top of each of these notes, you mentioned like whatever medication she's on.
That's
at the
correct,
time.
yes.
Are you and the nurse practitioner, Olivia Lieber, are y'all in contact about that, or is that relayed by the patient?
The psychiatric nurse practitioners or psychiatrists who prescribe psychotropics, they oftentimes refer a patient, and then unless there's a need, like for an alarm, situation, oftentimes we don't collaborate unless needed. So no, I would be reporting what Carly told me about her med changes.
Thank you for that. We talked about this, and I'm going to ask you about each time you saw
Sure.
Carly, what you noticed, who was in attendance on that day. Well, we might get stream on this. You said the only time anyone else was in the room was that first visit.
Correct.
What did you observe about her behavior on February the 14th, 2024?
Okay, and I'm just making sure I am looking at the correct note.
Yeah, I'm
let
on
me change
page
it.
8 of 24 of
Okay,
your
thank you.
records.
Everything that we have prior discussed was the same. The only difference was her appearance this time was just black clothing, not necessarily her grandmother's batwing black pants with the black shirt.
I want to take you to the next page, Rebecca. About midway down, she says, your record says, she rated hating herself, including her humor, and says she wouldn't be her friend if she wasn't her because she's dismissive of others' ideas when she knows it's wrong. Was that something that Carly related to you?
Yes.
Tell us about that.
She seemed to, again, be struggling with maybe some social stuff that I believed was stemming from her feelings of being different and having such a zest and fervor, and she really does love to learn. And so she would just talk about, it seemed like she was being introspective about, like, what kind of a person am I?
And it seems like a lot of her conversations, at least up to this point, revolved around her at school.
Yes, that's correct.
Was she kind of obsessed with being great at school?
Yeah, she liked school a lot. And she was glad that I could tell that she had been affirmed a lot in her life for being intelligent, and so she was proud of that, but she also just had a genuine love for learning.
I want to take you to your next visit with Carly, February the 21st of 2024, and talk about her appearance. Does it look like that's the same appearance and behaviors, thought process, no hallucinations, no delusions, things like that we talked about?
Correct. Nothing has changed.
Your treatment note, the very first line of that says she's reading The Castle and she likes it and will read Crime and Punishment. So you told us earlier that you were an accelerated English teacher.
Yeah.
What is The Castle? Because I don't know.
I actually do not know that one very well. I just know that they're well known. She also mentioned that she wanted to read The Bell Jar. But I had wanted to read Crime and Punishment for a long time, and I've actually owned a copy for 21 years. So I was really glad that she wanted to read the classic. I knew that was a classic.
Can you tell us, what is Crime and Punishment? Kind of what's that story about?
Crime and Punishment.
Objection, Your Honor. May we approach?
I asked you if you would tell me a little bit about what Crime and Punishment is about.
Crime and Punishment is about a protagonist, which is the main character. It was written by a Russian author back in maybe 1866, I believe. And it is the entire book, very difficult book, about a psychopath who lives in Russia, and he is poor. He is a student. He is very intelligent. And he comes on hard times, impoverished, and he has this obsession with this obsessive thinking of basically planning to murder a woman with a hatchet. And the novel kind of really, that murderous act happens pretty early on in the novel. And then the remaining novel continues to kind of be about his processing of it. And he even published something in the paper about why people kill and things like that. Anyway, and then he eventually is sentenced because of his admittance of his crime. That kind of also was found out as well. But he was declared insane, and he served 8 years in a Russian labor camp. And when he was in the Russian labor camp, he was unrepentant, and he did not think that what he had done was wrong and that the woman deserved it. He did actually kill her sister too with a hatchet to her skull, but that was kind of by accident because she came home too early.
And Rebecca, in your notes, you'd actually underlined the fact that she was reading that book. You brought
Well,
it to
that was just for
attention.
grammar because you're supposed to underline a title of a book if you can't italicize it.
Okay. Did you and Carly have any other discussions about reading any kind of literature, like kind of dark literature like that?
Not that I can recall. Oh, no. And to be clear, in this note, she had not yet read it. She was reading The Castle. This was on 2/21, and she was going to read Crime and Punishment, and she did so later. I think she read it the week of spring break, and I saw her Monday after spring break. That was my last session with her, the Monday first back after spring break.
Okay, thank you for that. I want to take you to the next note, February the 26th of 2024. Again, without belaboring the point, same appearance, behavior, speech,
Yes.
affect.
The only difference is appearance is black t-shirt and jeans.
In your notes on that day, it said something about she may be on the spectrum. Can you tell us what that meant?
Carly came in that session and she was telling me that she had a lot of symptoms of kind of autism, and that's what that means. And so, like Asperger's, and she was talking about just sensory issues and things like that, but yeah, that's what that means, yeah.
And so Carly was telling you that she thought she had autistic symptoms.
Yeah, I mean, she never used the word, but I knew, and most teenagers are very familiar with what that is, and I just assumed that she thought she had that, yeah.
And based off your treatment, did you think that she actually had autism?
I didn't. She did report too that her mother didn't either.
I want to take you to the next time that you saw Carly, March the 5th of 2024.
Okay.
Again, you saw her in person.
Correct.
And the history given regarding attitude, behavior, speech, affect, thought process, perception, orientation, memory, and concentration, kind of all that's the exact same.
That's correct.
In your note on that day, you have CBT and attachment therapies were discussed and explored to help alleviate anxiety. Can you tell us what that is?
Yes, CBT is shorthand for cognitive behavioral therapy and attachment therapy. So those are there are many, many different forms of therapy that we're trained in, and cognitive behavioral is really good for depression and anxiety. It's about kind of trying to analyze your unpleasant thoughts and basically, for lack of better words, get a grip on them and have a better life experience. Attachment therapies are rooted in this well-known belief and research about the parent-child bond and how we feel attached to people in our lives and how that influences us.
You also put in your records, boundary setting and identity work was explored. Could you tell us a little bit more about that?
Yes. So boundary setting would be just your classic, any kind of boundary you need to set to assert your comfort as a human being while also, not causing harm to another, obviously. But a lot of people have trouble saying no to people or sometimes saying yes to them, depending on the circumstance. So it's just kind of more of a work through of like, what do I want and how can I, in a healthy way, communicate that to others.
And at this point, Rebecca, is it safe to say, you're still in therapy, she's still in therapy with you, and you're trying to work on not cutting anymore, and these thoughts of just anxiety and depression that have been reported?
Correct. Mm-hmm.
There weren't any other known psychiatric things disclosed to you?
No.
I'm going to take you to the next time that you saw Carly, March the 13th of 2024, and again, talk about the in-person visit and the observations that you made regarding her appearance, behavior, speech, and et cetera that we've been through. That's not changed either.
Correct. It's the same.
She does report to you that Olivia Liebers changed her medicine because she reported feeling numb.
Yes.
She didn't laugh as much, nor did she feel as upset when her mom yelled at her.
Mm-hmm.
That she finished her reading. Is that what you were talking about, that she told you that she'd finished reading the books?
That's right. Specifically that one, yeah.
And she sort of relates like her anger to her mom's stress, I think. And I want to ask you about that. She says when her mom is less stressed, she feels it in less anger. Can you talk to us about what that meant?
Yes, that's kind of a poorly worded sentence. Sorry about that. I was kind of trying to do it while attuning to her. But basically, she appeared to me to feel some codependent feelings, or maybe be a little bit codependent on her mother's emotions. And when Ashley felt something, Carly, seemed to be affected by it.
And I think I misspoke, Rebecca. I said when she'd finished her readings, and then at the very end of that, it says she's about to read Crime and Punishment.
Yeah.
So that was the following week that you were talking about.
Yes, this is the week of spring break, and she was going to read it during spring break, is what that said.
And then she talked about her mom asked her to promise that she wasn't trying to be a boy. Can you tell us, and then you wrote, I think it was you wrote, due to her new haircut. Can you talk about that?
Yes. I think we only talked about her haircut maybe twice, and she had literally just gotten her haircut before that session. So that day, this would have been a week before my last session with her, I think. She had her med change, she'd gotten her haircut, and I think on a session before that, she had just expressed, I always kind of want to make sure someone's not feeling like identity problems regarding their sexuality or something that needs to be discussed. And she did talk about how her mom, I think, wasn't a fan of it or was a little bit afraid or something. I'm not sure. I really cannot recall, but I feel like the reason why I said this is because we had probably talked about it earlier, as I recall. And so I was trying to follow up. How did she think about your haircut? So she was okay with it. And she was like, yeah, she just said, that promise me you're not trying to be a boy.
And did you, in your 9 sessions with Carly, did you ever think that she was having some sort of identity crisis?
No. And in fact, I followed it up that time and the very next time, which was the last time I saw her, because the next time I saw her would have been the first time her peers at school had seen her new haircut. And I wanted to be sensitive to the fact that, are you being bullied at all? Like, because there were some other negative things that had been said to her and other peers. And she always answered with a positive affect, like, no, it's fine. And I asked her too, like, was that the truth to your mom? You can tell me, it's fine. I'm not going to discuss your stuff. And she's like, no, I told her the truth, or something like that.
So I want to take you to the next report that I have is a treatment date on March the 18th of 2024. Is that the last time that you saw Carly?
That's correct.
And I do want to talk specifically about each of these on March the 18th.
Okay.
So you saw her in person by herself, right?
Correct.
And you reported that she was wearing a black t-shirt and jeans again.
Yes.
What was her behavior like?
Completely normal, the same as it always had been. She had just gone back to school. It was Monday, the first Monday back after spring break. And this was was it a 5 o'clock session? I'm not sure.
Yes, it's 5:50 p.m. to 5:55 p.m.
Okay. And so 5:50 to 5:55, 5 o'clock.
5 o'clock. Yeah. Sorry. Yes.
So I met with her for an hour, and basically everything was the same that it had been as far as the way she appeared to me.
And at no time did she report any hallucinations or delusions? At no time did she report any memory or concentration issues?
No.
I want to take you to page 19 of 24. This is regarding your psychotherapy notes, that last visit you had with her. And she talked about kind of walking on eggshells consistently while mom's around. And I think you touched on this a little bit. Carly was maybe a little bit codependent on Ashley's feelings and behaviors. Can you tell us kind of what you meant, what that meant about walking on eggshells?
Yeah, but I think I want to say something a little bit before that, if that's all right.
Yes, please.
I honestly kind of had to lead this session with her and try to dig into some of this stuff that she might be feeling, because I was starting to really kind of wonder if I was really serving her the best I can. And, you know, if I can and someone else can, I want to refer someone. I knew that she was a school teacher. Blue Cross state insurance plans aren't real rewarding on that end. And so I really had kind of contemplated, am I really helping her? Because I felt that the sessions were really mostly about school, but I knew that there had been a big event with why she was coming. And so I really kind of honestly did a little bit of soul searching and decided before this session that I wanted to really try to go there to maybe some painful things that that she maybe was being hesitant to speak about. And so I did kind of bring that up, and I think that's important to note. Like, she didn't just start talking about her mom. I was trying to like really get to some hardcore stuff with her in this session. And she, you know, we talked about how her mom, you know, when her mom was angry, it was really hard for her to really handle that. And so I'm always trying to get a gauge, like, obviously, let's rule out abuse. I did not have any indication ever before, during, or after that her mother was abusive, but I can't make that assumption as a clinician. I need to really be sensitive to anything that might not be being reported. And so I wanted to get kind of a measure of like, what does Ashley look like when she's angry? And she described, and it's in this note, that, you know, she raises her voice sometimes, or slams doors, cabinets, speaks in shorter sentences. I think we actually discussed an example that's not noted here of, well, can you give me an example of her being angry or something at you? And she gave an example of maybe grading some tests of some kids. She's a math teacher, and so they were doing poorly on it, which is not what any teacher wants when she's grading tests that she knows she taught well, which I'm sure Ashley did. And she noticed her mood, and she wanted to be helpful, and she kind of maybe had, and I don't think maybe this event had necessarily recently happened. I was asking her to give me one so we could work through conflict resolution and her emotions and stuff. And she said that she had done, you know, like had offered to help her, and then her mother kind of snapped at her in response. And so I try to do a lot of work with like, okay, well, let's just take that example then. What do we do when we're upset? You know, how can we communicate calmly, clearly? I emphasize the importance of cooling off. You know, your body needs to self-soothe. When it gets flooded and your heart rate gets to a certain degree, you can't think properly. And so we talked about things like that.
And your report actually says you talked about understanding anger and how to respond to it.
Correct.
That anger is a secondary emotion, and how to confront her mom when she's cooled off was explored. Is that what you kind of just described to us? I went through ways for Carly to approach anger.
That's right. Underneath anger is really sadness or fear or a blocked goal of some sort. Yeah.
I know that's the last time that you treated Carly, but there's actually another note that was added to your records May the 16th of 2024. Could you tell us about that?
Yes. Whenever termination of care has occurred, it's customary for clinicians to do a summary note. Either, you know, sometimes very, very rarely, it just, no communication ever happens, but oftentimes it's the joint, you know, agreement or the agreement of one versus the other, and this was a very different case, and so I had to write a summary report on it like I would any other.
I want to talk to you a little bit about that, Rebecca. Okay. It talks about within 24 hours, something terrible had happened. Mm-hmm. And you state in your last session with me, she appeared emotionally stable, and she had no suicidal or homicidal feelings suspected by me nor spoken by her. So I want to ask you about that. You said that she didn't tell you about any feelings, but you didn't think that there was anything like that going on either.
No, that's correct.
And then you also noted that she did not indicate that her medication change from the prior week was negatively affecting her.
Correct.
What did you mean by that?
Well, anytime that a person's prescription meds change, you need them to be very concerned about side effects. depressive thoughts, feelings of suicide, things of that sort. And so I wanted to follow up and make sure she wasn't experiencing any negative reactions regarding that.
You also said that, nor did she appear different from any other sessions, nor emotionally unstable or dysregulated. Can you talk about what that means?
Yes, just kind of basically what we said, that was on the first part of each of my sessions. Like, she seemed very oriented to time and space and didn't seem to have erratic speech, loud speech, to be overly angry or overly happy, just, a normal situation, observance of her.
And then you go on to say she did not appear melancholy nor zoned out emotionally. Can you talk about what you meant there?
Yeah, she had reported several times that, at least one time maybe, but I feel like I maybe wrote it more than once, I'm not sure, that with some of the Zoloft, she felt like a zombie. And so, she never really appeared that way to me ever, but she had reported it, so I put it in my notes when that had occurred. But I was saying here that I didn't notice any of it as well.
And you talked about how you had gone through conflict management with Carly on the day before the incident.
Correct.
I think you also talked about kind of what you observed between Carly and Ashley's relationship. Can you talk about why you thought that was important to put in your record?
Yes, sure. Well, ordinarily, termination of care is in a very different manner, and I knew that this one was a very sad act that occurred, and I wanted to be clear that I did not ever observe them together other than in the waiting room, and I never really saw, anything that would allude me to believe that, or hint at any kind of very severe danger or threat.
At any point during your treatment and sessions with Carly, did you think that she was being physically abused by anyone?
No, never. In fact, I asked several times about the stepdad, and I'm very confident in her response, verbally and non-verbally, that it felt very much to me like that nobody that she was living with had been abusing her. Now, her biological father, yes.
And she described some incidents where he had been physical with Ashley as well. Mm-hmm. And then what about, I didn't see any note of this, but did she at any point ever report that she had been sexually abused by anyone?
No, she told me she had not.
Court's indulgence. No further questions, Ryan.
Cross-examination.
My high school English teacher is about to be very proud. I too read Crime and Punishment, and you're right, it was written in 1886 by Dostoevsky. And isn't it true the main protagonist of that novel, Raskolnikov, killed his neighbor? The woman he killed was his neighbor, and he killed her because he hated her?
Yes.
Yeah, I'm sorry, could you speak up?
Yes. Mm-hmm.
Yes. And isn't it true, actually, by the end of that novel, Raskolnikov felt so guilty about his action and was so remorseful that he didn't only confess, but he actually, in an act of remorse, bowed to the earth?
That's not the way I interpreted it, but that is the thing about literature. There's a lot of interpretations.
Yeah. And isn't it true, what the book is actually about? The act of murder happens in the first chapter. Isn't it true that the entire book is about how murder is such a horrible act and the weight and consequences that it carries on a person who does that?
Yes and no. You don't want to get me started. I'll go into my literature mode, but I really don't think the point of the book was about how murder is such a horrible act at all. I think it was about the psychological dilemma of someone mentally insane, and honestly, I think that's what that's about. It definitely is talked about, and there are different characters in there, including one that tries to kind of convert him to Christianity and stuff like that. But even when he's in the Russian labor camp at the end, he says that she kind of deserved to die. Like, I remember there being something like that. Don't quote me because it's been a minute.
But again, he hated his neighbor.
Yeah. She was a greedy, she loaned money to people and was very unkind to them,
Yeah.
but he didn't know her hardly at all. He just went and borrowed money from her.
And he was poor and she was demanding it back.
What did you say? I'm sorry.
And the main character was poor and she was demanding it back.
It was like a debt type thing. She wasn't, I don't know about the word demanding, but yes, she was greedy. She was definitely greedy.
So he had a motive.
Yes. Mm-hmm.
Did Carly hate her mom?
I never got that impression.
What impression did you get from Carly?
I got the impression that she had complex feelings about her mom, because one time we were talking about I tried to talk about the custody case a lot. Mm-hmm. And I knew it was literally going on, and they were supposed to meet, and I would ask, how are you feeling about that? Oh, and I'm fine. And I got the impression, I'm just going to let the adults work it out. She seemed to have a lot of trust in Ashley to care for her and to protect her, as well as her stepdad in that. And but there was one time when we were talking about the bio dad and then her mom, and she said emphatically, like, I know he doesn't love me, but I had to ask, like, do you believe that your mother loves you? And she really was a little unsure on that answer.
Yeah. But did Carly love her mom?
Yeah, I believe that she did. I had nothing to tell me otherwise.
Okay. And you said that Carly was a little codependent on her mom's feelings. Do you mean that Carly's emotions were real tied in to
Yes,
how her mom
that's
felt?
correct. Mm-hmm. It was probably mutual, yes.
Yeah. And the feeling that, the example about, her mom, the example about being angry Carly gave you was actually about an incident in which Carly's mom got angry with Carly when Carly had tried to help her mom.
Yes,
Grading
that's
papers.
correct. Mm-hmm.
Okay. And it really hurt Carly's feelings, her mom snapping at her when Carly was trying to help. It hurt Carly.
That's right.
Didn't make her angry, right?
Well, I can't speak to that. In fact, I would assume it does make one angry from what I know about emotion. Again, anger is a secondary emotion, and it is the more safe thing that we feel when we maybe feel threatened or unsafe. And it would be understandable that her environment growing up, she had to deal with a lot of emotions, that she didn't get to maybe express healthily. So that can make one be a little, anyone, and that's a normal thing.
And is it fair to say that Carly felt like she had to walk on eggshells around her mom because she didn't want to make her mom angry or
Yes.
more stressed out?
Mm-hmm.
Okay. And Carly was always very careful. She didn't want to hurt her mom's feelings, right?
I don't know about her always being very careful, but I do know that, and I think that would be impossible for someone to always, but I do know that she seems sensitive to her mother's feelings, yes.
And Carly didn't want to hurt her mom's feelings.
Right.
Is it fair to say that Carly really wanted to please her mom?
Yeah, I think so for sure.
Carly wanted her mom to feel proud of her?
Mm-hmm.
Is it fair to say that Carly didn't ever want to worry her mom?
I don't know about ever, but I do know that probably chiefly, like, no child wants to worry their parent. Yeah.
Is it fair to say that, Carly knew her mom was pretty stressed out and didn't want to add to that stress?
I really can't speak to, like, the level of stress she observed in her mother, but again, just making a basic assumption of any normal person, and she never led me to believe that she was different from any other average person. I would have concluded that, but I can't say that because I didn't observe every situation.
Yeah.
I only know what she reported to me when she came to me.
Okay. And is it fair to say that a person can sometimes, if their feelings get hurt and it makes them mad later, that a person can feel mad without expressing that emotion to others?
Yeah, absolutely. Yeah.
And did you in fact know that Carly never got a chance to read Crime and Punishment?
No.
I'm sorry.
No, it was my understanding that she did.
Well, it was your understanding that she was planning to?
No, I thought that she told me when she came back the Monday after spring break that she had read it, but
And the question that, that you had asked Carly about her haircut and her friends teasing her about cutting her hair shorter, and about whether that meant something about her sexuality. Isn't it true that in your notes you reported she actually laughed in answering that question and said
Right.
no?
That's right. Yeah.
Yeah. So she found that to be, somewhat a humorous.
Yeah. Right.
Yeah. Not a concern.
Well, what had happened, we were walking out actually with the padlock door, and I said, "Oh, what did your friends think about your haircut the first day back?" And she said, "Oh, they said it makes me look even more gay now." And I said, "Oh," I said, "is that a true statement?" And she said no, and I said, "Oh, well, I'm sorry." And then she replied with, "Oh, it's not a big deal. Like,
yeah, she's
doesn't bother me." Yeah.
Yeah. And on the handwritten initial assessment that Ashley wrote to you, is it true that in that she wrote that Carly had been having intrusive, and she marked the box for intrusive and disruptive thoughts?
Correct.
Okay. Is it true she marked the box that Carly was having thoughts that got stuck?
Yes, that's correct.
Is it true that she reported several different times on this page that Carly had really been experiencing some difficulty sleeping?
Yes.
And in her own handwriting, doesn't Ashley write that Carly was severely unable in the last month to sleep?
Yeah, that's right.
Okay. And somewhat for the last year?
Mm-hmm.
Isn't it also true that she wrote in her own handwriting that at 2 a.m. Carly had a habit of waking up at 2 a.m. and then not being able to go back to sleep?
Correct.
Okay. And isn't it true that Carly also wrote that Ashley had written that Carly seemed to have a poor self-image?
Yes. Wait, where are you referring to? I just want to
The
make
box.
sure. Yes, that's correct. Mm-hmm.
Okay. And isn't it also true that Ashley had marked the box that Carly had been experiencing panic attacks, and when asked how often, Ashley wrote Carly had at least been having one panic attack per month?
Yes, with the correction of it didn't say at least, it
Or
said
does it
one
one per
month.
month?
Yeah.
And isn't it true that Ashley had marked the box saying that Carly had been having difficulty completing homework or classwork?
Where's that one at? I'm sorry.
That one is, may I approach, Your Honor?
I mean, it does seem hard to read because I have written some notes to the left, but that would be surprising to me, but I'm not saying that it may not be checked underneath my handwritten note to the left. I'm really unsure.
It's just hard to read
Yeah,
because of the
that's right,
handwriting.
yeah.
So it could be, might not be.
Yeah.
And isn't it true that what is easy to read is that Ashley had written just a few short places down that Carly had been sad and withdrawn in her mood?
Yes.
Okay. And at the top of that page, and I know it's kind of a little bit messy,
Yeah.
but at the top of that page, isn't it true that somebody reported that Carly had made a 30 on the SAT?
Correct.
Or ACT?
Mm-hmm.
Okay, and that somebody had written in the response to the first question, what are your goals that you hope to achieve through counseling?
Mm-hmm.
Someone had written, either Ashley or you, she wants to feel better about herself socially, personally, physically insecure,
Yes.
and had been so since 5th or 6th grade.
That's correct. So she began by writing she wants to feel better about herself, and then I followed up with both of them and added more notes to give more detail to that. That's right.
Isn't it true also on that page, in kind of response to the question number 2, it says father had been emotionally and physically abusive,
Mm-hmm.
and also had bipolar
And drug
ADHD.
addict.
Yeah,
Uh-huh.
and drug addict.
That's right.
And that there had been times years ago that she had reported he, meaning the father, had been getting high in front of her the whole time during, I guess, visitation periods.
That's correct.
Okay. And then briefly describe your or your child's current difficulty. Can you read for us what's written there?
Yes, it says, this is written by Ashley. Carly has been complaining of sleeping trouble and thoughts of depression, hopelessness. We discovered issues of cutting and taking old sleeping pills. Those issues have been removed and controlled, but also signify the possible level of depressive thoughts.
Okay. So, Did Carly's mom, and on this page, there's a box for, hurts animals. That box isn't checked, is it?
There is a box for, no, it's not checked.
Okay. And it's also a box for hurts friends or siblings. That box isn't checked, is it?
Correct.
And during the course of your counseling with Carly, did you ever consider her a psychopath?
Never.
Did you ever consider her a sociopath?
Never.
And again, you've met with her how many times?
9 hours, roughly 9 hours, yes.
So 9 different sessions.
That's right. Mm-hmm.
From January to March. Okay. And were you aware that Carly had written in a journal about hearing auditory hallucinations?
Mm-mm. Unless it was the reference to that iPod. I'm not sure if they're considering that a journal or what.
But the reference.
I was never told about any kind of hallucinations. Just dark thoughts is the way it was described to me in that iPod.
Okay. And did you know that in one of Carly's journal entries, when she was talking about feeling like she was losing control of the auditory hallucinations, that she'd actually written in there that she had considered bringing her journal to you?
No. No, not at all.
Do you think that speaks to the level of trust Carly had in you?
I can't really speak to that. You'd have to ask her.
Were you aware of the fact that Carly has repeatedly told people that you were the first counselor she ever felt like helped her? Were you aware?
No, it's not.
If Carly would have reported to you during one of your sessions that she was experiencing auditory hallucinations, would that have been something you felt like you needed to report to her mom?
Not necessarily. I would have followed up with a lot of questions to determine if she was a threat to herself or others.
Okay. And if Carly would have reported to you that she felt like she was losing control of herself to the auditory hallucinations, was that something you would have felt like you needed to report to her mom?
Again, not necessarily. I would have asked her to clarify with a lot of questions. What does control mean to you? That means 1,000 things to different people. But if I had asked it enough to determine that she was a threat to herself or others, then yes, I would have reported it.
And is it fair to say that Carly had some fear in regards to her dad?
Her biological father?
Yes.
That was very perplexing for me, honestly. I just could not get her to open up a lot about what I knew had to have been traumatic instances. I mean, she seemed very indifferent and apathetic towards him. But, yeah.
And is it fair to say that Carly saw her father as someone who is not a successful person?
Correct. Yeah, she did not like him.
Yeah.
She was glad she was with her mother.
Yeah. And is it fair to say that if someone is afraid of having a certain mental health diagnosis, that might motivate them to not be fully forthcoming with their therapist about what they're experiencing?
Sure.
And if Carly would have told you that she was smoking marijuana to help her sleep at night, is that something you would have felt the need to tell her mom?
No.
Okay. Would Carly have had any way of knowing, without disclosing that to you, that you wouldn't have reported that to her mom?
Yes, she would, because I told her that on the first session.
Okay. But Carly had seen you talk with her mom before, correct?
Because she's smart enough to know that legally anyone under the age of 18 has to do it that way.
Yeah.
Yeah.
Okay. And did Carly or Ashley ever tell you about an incident in which Carly had gotten in trouble for taking a knife to school?
Never.
You don't recall that?
No.
Okay. And during the time in which you were with Carly, had either Carly or her mom reported to you that Carly had seemed to develop a hypersensitivity to certain sounds?
In that session note regarding the symptoms, she came telling me, she just gave me a lot. It's probably in that one. She kind of came in talking about a lot of symptoms that typically is customary to like an Asperger's or autistic diagnosis.
And that these certain sounds, when she heard them, kind of caused her to feel irritated?
Yes, but again, like it was not ever anything, I want to be clear, like a hallucinatory manner. It was all in the context of that person's tapping that pen or tapping their foot or something like that,
Yeah, not furious, but just annoyed,
Yeah,
irritated.
right.
Yeah. And based on your sessions with Carly, when Carly would mention, having periods of time when she would be questioning the meaning of life, did that seem to be during the time periods in which Carly was experiencing depression?
I need you to repeat that, please. I'm unclear what you're asking.
Yeah. When you talked about that Carly would have these existential times and she'd be questioning, the meaning of life and things like that, was that also during periods of time in which Carly was experiencing depression?
Well, that's what was kind of problematic about treating her, is that was really the only thing of real emotional conflict that I ever had her report, and it was because of the iPod stuff. And so I kept trying to kind of dig and find out what was troubling her. So, I mean, during that's what I'm talking about with the existential. She didn't really open up a whole lot. The last session we did talk about kind of reality and life and morality and some things like that, but but it wasn't because she said she had been upset about it and needed to discuss it. It was based on something, I think, as I recall, her father is a Jehovah's Witness, her bio dad, and she knew I was a Christian because that's something that I like to tell people so it doesn't blindside them if they're different. And she said, "I'm sorry, I know you're a Christian. He's a Jehovah's Witness, and I believe that that's definitely a cult, So we kind of talked a little bit about it that way thematically, but not in a way that was, like I'm troubled and I need to talk about this kind of thing.
Yeah. And during your sessions with Carly, did she ever strike you as a violent child?
No.
And when you learned about the events that had transpired on March 19th, were you shocked?
It's the most shocking day of my life.
And that's based on the 9 sessions you had with Carly and the hours you spent with her.
Yes, because I had no clue that nor had she ever reported that she was severely mentally troubled to any degree like that.
And you just, based on your knowledge of Carly and her relationship with her mom, you were shocked to find out what had occurred on March 19th.
Yes.
Thank you. We tender the witness.
Distinguished reader up.
Rebecca, as a therapist, how many people do you see that have complaints about depression or anxiety?
Almost every single one of them.
How many of them have gone on to kill their mom?
0. Oh, sorry, her. Before that, none.
Do you have any patients that have ever reported hearing voices?
I have, sometimes, yes.
And how many of them went on to kill their mom?
None.
You were asked about whether or not Ashley being mad at Carly made Carly angry and hurt her feelings. And I think you talked about anger being the second emotion. Did that make Carly angry? Sorry, you got to answer.
Yes, sorry.
You were asked about Carly wanting to please her mom and not worry her. Someone keeping secrets from their mom about a phone mom didn't know about, a secret boyfriend, the fact that someone's using drugs and cutting themselves. Does that sound like somebody who's so worried about hurting mom's feelings to you?
Can you please repeat that question?
Yeah, sorry, it was a bad one. You were asked about Carly not wanting to anger her mom.
Right.
And keeping secrets from your parent, doing things that are dangerous. Does that sound like somebody who's worried about hurting their parents' feelings?
I mean, honestly, it's I can't really speak to that. I mean, I would think that there could be a lot of motivations regarding that, but
Carly never reported having any mental health issues other than depression or anxiety to you, correct?
correct.
No further questions, Your Honor.
All right, this witness be finally excused by the state.
Yes, sir.
By the defense.
Yes, Your Honor.
All right, ma'am, you're free to leave. If you would hand that to the bank.